Hi, my name is Ibrahim, and I'm the founder of City Health Tech. We're an organization focused on preventing the spread of disease so you don't feel like a little kid sick in bed. There are a billion cases of the common cold in the US per year. This results in more than 100 million days of work missed, impacting the US GDP on a loss of $40 billion. Due to all preventable illness, we missed out $100 billion in US productivity. It was shocking to us when we found that 80% of disease is spread through contact. And we learned that only 5% of people will wash their hands correctly. But this makes sense. This is because most people do not wash for the full 20 seconds. 20 seconds is a long period of time. It's the equivalent of singing the happy birthday song twice. There's no way to ensure compliance to 20 seconds, especially in regulated industries, and there are poor data sets on hand washing times. With such a small behavior, it has a big impact. Imagine if everybody washed their hands for the full 20 seconds. That's why we invented Opal, the future of hand washing. We have superior design in comparison to anything else that's on the market. We have a simple setup that is easily attached to the sink, and we have data to provide a data-driven solution to assure that our device is working. Here's an example of what it looks like. As you approach the sink to wash your hands, you'll be greeted with an animation and a series of screens that can be anything from hand washing technique to live news updates, company spotlights, or even knock-knock jokes. You can see that here has a visual indicator and a loading bar in green that shows what your progress is in hand washing times. This screen can be tailored and customized to almost any demographic. But it's been a long journey. We've been focusing on this for almost 3 years. This device was our first prototype in which we thought people knew about the 20 seconds, but we just need a visual indicator. But what we found is that most people did not know they should be washing for 20 seconds and that it takes a lot to engage someone for that full amount of time. That's why we invented a device with a screen and we focused on still attaching the sink, but came up with more design issues because there's so many different types of sinks. That's why we designed our current prototype that simply sits next to the sink and encourages hand washing behavior. We have currently been using off-the-shelf parts and 3D printers, and this is what our device could look like with full manufacturing processes, which we already have contacted in terms of our manufacturing to get us to scale. Our device also gets you hands-on data, anything you could want and imagine in terms of hand washing times, from location to frequency to all the different types of hand washing stats, from averages to max and minimums. In the last year, we've been focusing and committing to having clean hands in schools. We've been piloting with 5 schools in the Chicago area, impacting 4,200 students. There have been dozens of studies that have shown with hand washing education alone, you can reduce rates of infection and increase rates of attendance by almost 20%. That results in $262,000 in savings to schools, given that every day a student is missing, they'll miss out on $30 to $100 in funding. In terms of our contracts, we have about $7,000 in revenue and delivery of our devices. We're targeting 73 schools, but let's imagine if we did this all across Chicago. That's 660 schools and more than 500,000 days of school instruction gained. But when coronavirus hit, we had to end all of our pilots with schools now that they were closed and rethought the way we were approaching hand washing in our model. We accelerated our timeline now that everyone knew hand washing is important. We got phenomenal press from ABC, TechCrunch, the Obama Foundation, Fox, and Forbes to really promote our message. And from that, we got amazing customers from Microsoft, McDonald's, Subway, Bright Horizons, and Cytex, a distribution company. In terms of our business model, we're charging $125 per device and $10 per device for access to our data and dashboard. We offer hand washing compliance, hand washing technique, community safety as a visual indicator on you caring for your employees and customers, data analytics to assure devices working, and tailored content. For example, Bright Horizons, we can have educational content on, for example, word of the day. Microsoft can have company news updates and employee spotlights. McDonald's can have new promotions on their new menu offerings. In terms of our go-to-market strategy, this is our current hypothesis. We're currently working with B2B. This next year, we hope to continuously expand that and look at our international deployment. In 2022, we want to look at direct-to-consumer and then eventually launch to direct-to-consumer and being in every person's home. And the market is massive, especially when you look at the annual recurring revenue for things like schools, businesses, restaurants, and hospitals. But if you really look at the massive opportunity, it's the billion-dollar market when we look at the consumers at homes. But we're focusing on businesses to get us to scale, and then we'll focus on what it looks like to deploy to people's homes. In terms of our competition, we're the only device that is under $200, is simple to install, has continuous education, and we also target many different markets rather than all the competitors having expensive solutions focused on healthcare. We also capture all of our data anonymously. We have our financial model, which shows that we can get to nearly $3 million in revenue, but this is relatively conservative. One of those deals with, for example, Microsoft or McDonald's is a multi-million-dollar contract. We have an amazing team that's going to get us to market, such as our CTO, who has years of experience in IoT implementation, electronics engineering. Zakora, who is a design engineer in medical heart stents, Lay, an award-winning advertiser, Tobel, who has her master's from data analytics from Chicago, and Omo, who is a health communication specialist from Columbia. We've won many awards, winning over $25,000 over the last year to help us bootstrap and get us to where we are today, and we're recently named one of the most promising startups in the country. For the $150,000 will get us to pretty much our first deployment and to get to our first customer. $22,000 of that we reserve to manufacture 250 devices to get to the hands of students and essential workers. We are building the future, preventing cities across the world. We think we can have a fundamental impact on the way we're approaching disease prevention and really change and save lives. Thank you.